I'm Alina Paul, staff nurse working in Paalana Institute of Medical Sciences. Today, Paalana Institute of Medical Sciences celebrates International Patient Safety Day. The theme for this year is Improving Diagnosis for Patient Safety with slogan Get It Right and Make It Safe. As part of this, we have conducted several competitions such as poster presentation, hand hygiene compliance and elocution. The prize distribution was done by the Director of Paalana Institute of Medical Sciences, Father Walter Tellapilli, Consultant Physician Dr. Deepak and Nursing Superintendent Sister Grace Mary offered heartfelt felicitation to the program. Through this celebration, we are trying to focus on improving patient safety. So let's see what are all the 6 goals of patient safety. The first goal is identify the patient correctly. We have to use at least 2 identification data, that is patient name and hospital number or the unique identification number of the patient before every procedure to prevent any errors of administration. The second goal of IPSD is to improve effective communication. I strongly believe as a healthcare professional, it is an essential quality that all the healthcare professionals should possess. Standard protocols such as ISBAR, that is identification, situation, background, recommendation, can be very useful in this type of communication. And also standard protocols such as read back and repeat back method can be very essential for this. The third goal is improve safety of high alert medication. As its name indicates, it requires high alert or high attention while prescribing or administering. So we have to firstly identify the high alert medications and prescribe it accordingly. It requires standardized storage and labeling, and LASA medication, that is look alike and sound alike medication, should be kept separately and checked thoroughly before administering. The fourth goal is ensure safe surgery. It includes ensure correct site, correct procedure and correct patient surgery. We have to follow universal protocols such as pre-operative verification, timeout, that is the final verification before the procedure, and also surgical marking of the site is important. And it is a good idea to include the entire surgical team in the verification process. The fifth goal is reducing the risk of healthcare associated infections. Standard infection control practices such as sterilization, hand hygiene and use of personal protective equipments like masks, surgical gloves and goggles can be very helpful. And proper disposal of the biomedical waste is an important element in this. Prevention of infection from central lines, surgical sites, catheters is also a greater attention required thing. The sixth goal is reducing the risk of patient harm resulting from fall. When a patient gets admitted, the nurses can assess the risk for fall so that they can prioritize the care accordingly. And use of certain equipments like bed rails, grab bars and non-slip footwears can be helpful. Safe transfer techniques like wheelchair with belt, trolley with belt is also an important thing. And lastly, we should educate both the patient and caregiver about these prevention strategies. I hope these informations were useful for everyone. Thank you all.